The Healthcare Labyrinth podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth podcast. My name's Mark Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Today's topic is we're going to go a little bit into employer coverage today and also talk about some recent trends that have come out of a very prominent annual survey called the Business Group on Health's Annual Healthcare Strategy Survey. It sort of gives us a glimpse into the year-to-year status of employer coverage as well as long-term trends and what employers are expecting in terms of costs and things like that. This will be a relatively short podcast. We'll take a couple of breaks as well, but let's get right into it. So I really want to start out with the fact, as everyone really knows, that our healthcare system is really based on employer-sponsored coverage. It is by far the leading coverage of individuals in America. And we have sort of a patchwork system after that. We have various other programs that are filling in the voids to get as close to universal access as possible. Now, as you know, in my previous podcast, I tell you, we do not guarantee affordable universal access by any means. We took a step in that direction with the Affordable Care Act and Obamacare, but we certainly haven't reached that. And probably next week, I'll be going into a brand new Commonwealth Fund study that compares our healthcare system from a spending and a quality standpoint to the rest of the developed world. And the main point there is that we do not guarantee affordable universal access, and therefore we have tremendous gaps in the system. And I'll tell you a little more next week about quality and things like that compared to the developed world. But in the meantime, let's talk a little bit about how many people are actually enrolled in employer coverage compared to other types of health insurance coverage. Well, I always like to go to the CMS Actuaries annual calculations of costs and enrollment and things like that. It sort of comes out late every year for the prior year. And in this case, I'm dealing with 22 statistics, but to me, they're the most reliable. And what the National Health Expenditure from the CMS Actuary found for 22 is that we had a total of over 400 million people enrolled in various types of coverage. Now, we know that we only have a little over 330 million people in the United States. And the reason for that difference is people can be enrolled in different types of health coverage throughout the year. Somebody who perhaps is working and is 64 and 9 months in 22 had employer coverage, but then they rolled over in that same 22 year to Medicare. Others may have perhaps Medicaid in one part of the year and the exchanges Obamacare in another part of the year. So it's not too surprising that there's about a 60 million people that overlap out of our total population and have more than one form of coverage in a given year. But this is still a really great way of having a barometer for how many people are in various government programs or in private employer coverage. So in this case, out of the rough 400 and some million, about 175 million people in 22 were enrolled in employer coverage. Just for some other statistics, about 64 million were enrolled in Medicare in that year, 91 million in Medicaid, 7 million in the state children's health insurance program, about 15 million in other public programs. There were about 30 million people, that had other forms of private coverage that were sort of direct enrollment, that were not in employer coverage. Some of that obviously was the ACA and the exchanges. And then last, of course, you had about 27 million people who had no coverage, that were uninsured at any point in time as well. So that sort of tells us that somewhere around 40 to 45% of people are actually enrolled in employer-sponsored coverage. So you can see that employer coverage truly is the mainstay of the healthcare system in America. Let's look for a couple of minutes too on expenditures. While 40 to 45% of folks are in employer-sponsored coverage in the United States, the amount of spending is actually much less than that figure. So in 2022, the amount of healthcare spending in our system was about $4.46 trillion. And the CMS actuary in the National Health Expenditures account basically told us that employer-sponsored coverage had about $1.3 trillion in costs. So that's somewhere around 30% to 1/3 of expenditures in the country are from employer-sponsored coverage, with, again, about 40 to 45% of the population enrolled in it. So again, in summary, employer-sponsored coverage is a key part of what happens in the United States. I would also tell you that rough 175 million number is about pretty consistent for the past number of years. And I'd also note that it was consistent during the COVID pandemic. And why was that? Well, while there was a great deal of job losses during the pandemic, Congress actually passed, as part of these relief bills, the subsidization of continued employee coverage for those folks that lost their jobs. Normally, somebody would enroll in COBRA and usually have to pay the full amount to stay in coverage for example, 12 to 18 months while they find another job. But in this case, one of the COVID Relief Acts actually gave pretty much 100% subsidy to continue people on employer coverage. And so that was a remarkable thing for the country. And that meant that during those COVID years in 20 and 21, the rough 175 million people enrolled in employer-sponsored coverage in America stayed about the same. And with that, we're going to take our first break, and we'll come back to get into the Business Group on Health's annual healthcare strategy survey.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. As I said, we'll probably have a pretty short podcast today. We're talking about employer coverage, and we told you about a very important survey that comes out that helps us grade year to year, as well as long-term trends for costs and things like that. And it's called the Business Group on Health's annual healthcare strategy survey. Well, the 2025 survey was fielded between June 3rd and July 12th of 2024. The survey was completed by 125 employers, which cover more than 17.1 million lives in the United States. U.S. and multinational companies with employees in the United States completed the survey, and the employers ranged from under 10,000 employees to 100,000 employees and over. About 73% of respondents had more than 10,000 employees. So it really does represent what I would think of as the large employers out there. They represent a broad range of industries, which is very important because healthcare coverage can certainly be dependent on the type of industry you're in and the profitability of that industry. And again, remember that most Americans, a plurality of Americans, are covered by employer-furnished insurance. And again, this is usually self-insured or risk coverage, although there are some large employers that enter into risk arrangements with health plans as well. So what does the survey tell us overall? Well, the results of that 2025 survey taken between June and July of 2024 tells us that we are once again in an era in employer-sponsored coverage of very high inflationary increases for the overall provision of health benefits to employees. Looking at projected annual increases before plan design changes, meaning this would be to fulfill the current benefit package that a plan is offering in 2024, the projected trend for 2025 is expected to be almost 8%. So 8% added on to the regular employer's bill before contemplating any real plan changes to bring that number down. What's interesting is that, again, that is increasing rather dramatically. It is going to rise from about 6% in 2022, again to almost 8% for 2025. So that's a pretty hefty increase. Even after design changes, annual healthcare costs continue to grow at a rate exceeding pre-pandemic increases. So coming out of the pandemic and through 25 now, the cost trends, even after design changes, will be very robust and they will exceed pre-pandemic increases. We don't know quite sure what that will be yet because those final plan design changes for 25 aren't done yet because there's several more months to finalize those plan design changes. The survey finds that this points to a more than 50% increase in healthcare costs since 2017. That is clearly robust inflation, and that's a real killer for employees here. Well, the survey also tells us a couple of other interesting things. It finds that the trends will persist beyond 25. And as employers always do, this is where our employers are very compassionate. They will likely absorb much of the increase as they have done in recent years. So that 8% increase in 25 before plan design changes, the vast majority of that will be covered by employers. And that will obviously impact other parts of the employee's business. But clearly, we have had rising out-of-pocket costs for employees nonetheless, because some of this is obviously passed on to employees. And the trend has been rising out-of-pocket costs for the past many years, and that will continue and perhaps grow a little bit over time. And that really does cripple employees. These are premiums increasing, obviously, deductibles increasing, coinsurance and cost sharing and copays increasing. And then, of course, a diminution of benefits, which means that perhaps a family and the employee have to pay out of pocket for other costs that are no longer provided by the employer health insurance plan. So what is driving these cost increases? Well, we do have the return of normal utilization inflation in the healthcare sector post-pandemic. As we know that during the pandemic, there were very few health services being provided other than the COVID crisis services in hospitals and things like that. But now we see the utilization inflation returning. And as we know in healthcare, utilization inflation is always very robust. But the biggest culprit is actually drug spending, as you might have suspected. The survey notes that between 2021 and 2023, the median percentage of healthcare dollars spent on pharmacy has jumped from 21% to 27%. That's a shocking number. That's actually just a 2-year period, not a 3-year period, 222 and 223. And that represents about a 28 to 29% increase in drug spending. And so that's about 14 to 15% annually in those 2 years. Now, again, part of that can be growth in utilization of drugs. Part of it can be the inflation on drugs. And part of that can even be new introductions of drugs that employees are on. But that's a 14 to 15% annual increase from 21 to 23, which is very remarkable. This means actually that nearly all of the healthcare cost increase noted is related to pharmacy costs. So the return of utilization inflation is a very, very small part. Nearly all of the increase is really attributed to drug spending. As a result, employers are very, very worried about where drug spend is going. We know that there are retail drug utilization and huge cost increases, but there are also medical drugs for cancers and drugs administered at doctors' offices as well that are increasing dramatically. Employers are really registering the following concerns from the survey. First, 76% of employers are, quote, very concerned, unquote, about overall pharmacy cost. 58%, number two, are very concerned about the opaqueness of the pharmacy supply chain. They simply don't understand it. Third, 56% are again very concerned about the lack of transparency in pharmacy contracting and rebates. Fourth, just 1% of employers think that the prescription drug market is competitive enough to keep prescription drugs affordable. And last of their concerns that I'm citing here, a majority of employers call for a combination of market and government reform to curb drug prices. So that's very interesting. You have a bunch of free market folks at businesses that are basically saying we need market reforms, which they're involved in every day, but we also need the government to step in to curb drug prices as well. And I think they understand better than anyone that the drug market is not a free market, as I always say. One of the biggest drivers of increases in drug costs are GLP-1 weight loss drugs. 96% of employers are either very concerned or concerned about the appropriate use and long-term costs of GLP-1s and related weight loss drugs. 79% of employers have seen an increase in interest in obesity medications. This is really a result of coverage for disease states, but also the expansion to obesity only. And I'd like to sort of deep dive here a little bit. Throughout all of our different kind of product types, whether it's employer coverage, Medicare, Medicaid, or even the exchanges, we have seen GLP-1s for use for those with disease states like diabetes or cardiovascular disease have certainly increased, and they have sort of become part of a normal routine and part of drug formulary coverage for really most lines of business. So if you have a disease state and you're overweight and you can benefit from one of these GLP-1 drugs, you sort of get it, because the idea is that your disease state will become in check if that happens. However, employers are about the only ones that have extended to a great extent these GLP-1s for weight loss to populations that do not have disease states like diabetes or cardiovascular disease, but are only either obese or overweight. And so really the rise in GLP-1 costs for employer coverage are tied both to the adoption for disease states, as well as because the employer-sponsored world made the decision to cover these drugs on behalf of their employees if they were overweight or obese. One interesting statistic, about 70% of employers currently cover or will cover in 25 GLP-1s for obesity alone. So that's a pretty interesting point. Another 13% are considering it in the future. About 87% of employers rely on prior authorization requirements to manage GLP-1s, with more than half using BMI, body mass index, or existence of underlying disease states as criteria to authorize the drug. About 52% require patients to also participate in a weight management program. In addition to the GLP-1, the survey also finds that the disease states that are driving the greatest pharmacy costs are these top 6 here. And many of them have new and novel, very expensive brand name drugs. Cancer is number 1. Musculoskeletal conditions, number 2. Cardiovascular disease, number 3. Diabetes, number 4. Mental health, number 5. And gastroenterology conditions, number 6. With that explanation, we will take our second break, and we'll come back to tell you a little more about what employers are going to do to temper the costs.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you're enjoying this episode of the Healthcare Labyrinth podcast. We're talking about employer coverage, major trends and costs, and the fact that drug costs are really driving most of those increases. We're now at our point in the podcast where we're going to talk about what will employers do to temper rising costs, especially drug costs here as well. So among the strategies to limit costs are the following that the survey says employers will attempt to do. You can check out the survey at the link in my blog that I posted the other day. You can find the blog at the blog tab, and the date that the blog was published was September 19th, 2024. So anyway, these are the strategies that employer groups are probably going to employ, and we'll go a little bit into some of them. 82% of employers will leverage an RFP process to drive better pricing or strongly consider doing so. I think that's a very important component. Oftentimes, employers get a little lackadaisical. They stick with given healthcare partners, whether they are plan administrators or PBMs, and they're probably not getting the best deal. So it's important to go out to the market every couple of years to make sure that you're getting the best deal possible and that your plan administrator health plan and your PBM understand you're really looking at what they're doing to save money and deliver the best quality. 85% will replace underperforming vendors or strongly consider doing so. That goes a little bit with that first item. 52% will limit or reduce GLP-1 coverage or strongly consider doing so. So again, we talked about earlier that the employer-sponsored world, being more compassionate perhaps and being a little looser with dollars, is the product that is allowing these GLP-1s to sort of proliferate a little more to help benefit their employees. So perhaps less restrictive prior authorization for those with the disease states using GLP-1s, but also that move to cover individuals that just have obesity or are overweight and don't have disease states. So again, that compassionate policy is in employer coverage. But here you get a signal that businesses may try to rein that in just because of the costs. And that probably could have been predicted, right? We see some of this already occurring. And again, it says 52% of employers will limit or reduce coverage perhaps in the future, starting as early as 2025. And last of the major areas that employers are going to look to reduce cost, 54% will adopt a transparent pharmacy benefit manager model or strongly consider doing so. As we talk about often in the podcast, transparent pharmacy benefit models basically have a fixed cost for the PBM, and basically you transparently know the cost of your drugs and the reimbursement to pharmacies, and essentially that cost is passed through to you, the employer, and then the PBM has some sort of fixed fee on top of that to administer the program for you. Right now, we have various models that the legacy PBMs use that really are very expensive and not working and really lack the transparency that we need in the system. There are some legacy PBMs that are adopting more transparent models. I don't believe they're truly transparent, but they're trying to get a little move toward transparency. But there's also a whole bunch of new startup PBMs out there that are fully devoted to this transparency model. And some of these transparent PBMs are actually gaining some ground on the largest players out there. It will take a long, long time because the big three, which is CVS Caremark, Express Scripts owned by Cigna, and Optum Rx owned by United Healthcare, really dominate the market along with a couple of other PBMs. But these transparency models and these transparent PBMs are starting to make some inroads. And so you can see here more than half of employers want to really adopt the transparent pharmacy benefits manager model. With that, we're going to take our last break and we'll just come back with some concluding remarks.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth podcast. We've been talking about employer-sponsored coverage, how big it is, how many people are enrolled, how much it costs, the overall healthcare system, big trends that we are seeing now in terms of costs annually in the program, as well as the fact that drug pricing is really dominating these cost increases and what the employers are trying to do about it. So we'll just wrap up with a few thoughts here. The strategies outlined by employer groups, in my mind, make a great deal of sense. It is often true that employers, again, do not go back to the market often enough to drive down costs. And employers really have to hone their understanding of what's happening in the market to really get the best deal out there. So the more you go out there, the more employers study what's happening, the better price they're going to get for their overall healthcare packages for themselves and for their employees. And asking for transparent arrangements from PBMs, as an example, or even your health plans, which also on the medical side have very opaque models, will hold great promise in the future. It also is likely that employer groups that have been very open to liberal use of GLP-1 weight loss drugs will have to rein in access somewhat, as we saw in the statistic that over 50% will likely limit or reduce GLP-1 coverage or will strongly consider doing so. However, the real solution to me is allowing employer groups to access the Medicare drug prices that are being negotiated as they roll out over time. Some of this will occur anyway as the market becomes aware of the Medicare negotiated prices and employers may demand steeper discounts. But the easiest way to begin relief to the employer market on the drug costs is to expand Medicare drug pricing to the commercial world. This would again help reduce costs much faster and actually bring down inflation in the biggest aspect of our healthcare system, employer coverage. We need to safeguard it. We need to make sure that costs come down. We need to ensure it's stable. And we also need to ensure that employers can remain competitive around the world. And as we know, employer coverage is a cost that American employers bear that are not necessarily borne by businesses throughout the world. So it's a very important economic issue as much as it is a healthcare issue. With that, we'll conclude this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Mark and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.